I'm Mark Reed Edwards, marketing leader at HFS. Welcome to the first in a special series of videocasts with our healthcare and life sciences practice leader at HFS, Rohan Kulkarni. Rohan, welcome.
Morning, Mark. How are you?
I'm doing pretty well. It's great to kick off this new series. You and I talk quite a bit about your work, and I thought it would make sense to just let people out in TV land get a glimpse of it. So in this first episode, we plan to look back on the past few months and share what Rohan has published right up to the most recent research on hfsresearch.com. Then we'll turn our gaze to the future. So Rohan, let's have a brief look back, maybe starting with your life sciences top 10. Can you tell me about that?
Absolutely. We published the life sciences top 10 in December of last year. To me, I found that to be a very insightful and exciting compendium of our research. A couple of things I'll call out with that. What we noticed with a lot of our service providers, and there were about 14 service providers who participated in that the adoption of emerging technologies and also their creation of more complex use cases have made their capabilities extremely sophisticated. And consequently, I believe that a lot of our service providers are primed to disrupt the life sciences marketplace. So that's an area that I will be watching extremely closely over the next couple of years as that continues to evolve.
It's a dynamic marketplace, and certainly, over the past 2 years, we've seen what it can produce. So it'll be exciting to watch that.
Absolutely.
Yeah, and you also published the Healthcare and Life Sciences Research Agenda. Can you give us a glimpse into that?
Absolutely. We will be launching. We've actually launched our healthcare provider top 10 as of last month, and we have a pretty healthy participation list in there. I won't quite say who it is right now. We will wait for the release of the report here in the next couple of months. But I am extremely excited about that because not only are we going to be looking at the capabilities of the service providers, but we're also going to be watching how they're performing in 3 different market segments of the healthcare providers, which is the primary care, acute care, and the post-acute care or rehabilitation space. So we're really looking forward to that. That's just underway. And later in the year, we will also be launching our healthcare top 10, which is a focus on the health insurance marketplace. And we will be looking at the government markets, which is Medicare and Medicaid. We will be looking at the commercial insurance marketplace, but we will also be looking at the individual marketplace as well. So we'll, just like with the healthcare provider top 10, we'll also be digging into multiple markets there with the healthcare top 10 focused on the health insurance. But in addition to that, Mark, I also want to call out the fact that we are continuing to do thematic research. There are 5 key themes that I'm focused on. The first one is around health economics. I keep harping about the fact that in America, we spend over $4 trillion or about 18% of our GDP on healthcare. But we really don't have much to show for that in terms of the health outcomes or the efficacy of experiences, if you would. So we're digging into understanding why that is and where it is likely going to change. We'll be looking at consumer engagement in greater detail. We've got a couple of point of views that have already been published, but essentially the idea here is that there's nothing called experience in healthcare, because if you think about it, going to a dentist or a proctologist can never align to a good experience. It just doesn't exist. So we're looking at it from an engagement standpoint more. A lot of excitement around digital health, right? Digital health to me is not only about the use of technologies, but it's also about emerging and new business models that are extremely necessary in healthcare. And there are a lot of extremely creative people out there who are creating various different models out there in the world of digital health that I'm focused on. 2 other areas, social determinants of health. There is vast acceptance of the fact that the underlying attributes from a societal standpoint, such as education, the amount of money you make, where you live, and so on and so forth, have a genuine impact on the health outcomes. And we don't seem to do much about it. Generally focus more on sick care rather than the health part of the equation. And the last theme that I'll be focused on is on organizations. It aligns very well with the broader HFS research agenda that includes one ecosystem as well as one office. So those are the different themes that we will also be digging into.
So what are you doing in your spare time? You've got a full plate, Rohan.
Look, health and healthcare is a calling, right? I mean,
Yeah.
this is very personal as compared to other parts of the industry. So,
Yeah.
not a whole lot of gap between work and non-work, if you will.
Yeah, yeah. Yeah. So what have you been up to most recently? You did some great work late last year and leading up to the early part of this year. What have you been up to recently?
Yeah, Mark, a couple of perspectives that we've published that are extremely exciting for me, and some of the feedback I've gotten from the industry observers, if you would, is around digital health in primary care. I've been working on a thesis that suggests that digital health is disrupting the primary care space to a point where it could very well signal the end of health insurance in America as we know it. I think this is one that I would encourage all of us to stay tuned on because it is an evolving space.
Yeah.
The other perspective that we published recently that is very exciting to me is the fact that large employers who are self-insured, that is to say that they are underwriting the medical risk of their employees, have now attracted the most enrollment across all healthcare segments in America at this point in time. Almost 25% of all Americans are enrolled in one or the other self-insured health plans, which is to say that large employers will probably have a very large say in terms of how health and healthcare benefits are going to be delivered in the coming years, if you would.
Mm-hmm.
And then the other thing, and I kind of mentioned this earlier as well, is that we've launched the Healthcare Provider Top 10. Very excited about that, given the fact that there's a very large number of participation in that. So I would encourage us to stay tuned on some of the results of that we will be publishing in the May-June time period.
Yeah. One of the things I love about talking to you is thinking about the future. So let's narrow the aperture a bit and think about what do you see coming in the next couple of months? What can we expect?
Yeah, I think you used the word dynamic. I think the health and healthcare space is extremely dynamic. Business models are changing, emerging technologies are being adopted at an accelerated pace. But from our standpoint, we will be publishing what I'm calling digital health's most promising profiles of a couple of digital health companies who exhibit the most promise in terms of impacting the triple aim of healthcare. Triple aim of healthcare being the ability to reduce cost of care, to improve health outcomes, and to enhance the experience of care. So that's one of those that we're looking at, that I will be working on. The other one that I will say is probably the first of its kind by an industry analyst is a perspective around moral determinants of health. I mentioned social determinants of health a few minutes ago. Social determinants are kind of the societal imperatives, if you would. But what we've also recognized with social determinants of health is it lacks a level of empathy, equity, and fairness in terms of how we think about health and healthcare. So this is a collaborative piece that I'm working on around moral determinants of health, which should be published here in the next couple of weeks, I hope. The last thing I will call out is we will also be publishing our perspectives on wearables, particularly medtech, because again, wearables are a key aspect of that digital health primary care aspect, where there's a level of continuous monitoring that is required so that clinical intervention is on a needed basis versus the way it is today, which generally increases the cost of care versus not. Two other areas of interest is metaverse in healthcare. There's a lot of excitement there. We are going to kind of discern the myth around metaverse in healthcare and the practical applications of that. So that's an area that I'm working on. And lastly, price transparency. Look, I will tell you that the Biden administration made price transparency for healthcare providers or hospital systems a mandate back in January of last year. That is going to be extended to the health insurance companies in July of this year. So we are going to be digging into understanding what does that really mean from a consumer standpoint, and kind of again peeling back the myth versus reality of what price transparency could mean to consumers. So lots on the docket here going forward.
Yeah, well, this was a really great glimpse into your world, Rohan. I really appreciate you joining me for the first of many discussions we'll have over the coming months. To learn more, you can head over to hfsresearch.com. So thanks for tuning in. We'll see you on the next HFS videocast.
Thanks, Mark.